Thank you very much, Pedro. Good morning, everyone, and thank you for being here in such large numbers. In this brief talk, I will give you a few words of background on the first and second versions of the Global Malaria Action Plan, GMAP 1 and 2, and then maybe give you a brief introduction about a specific aspect, but an important one, of the GMAP 2, the multi-sectoral action framework approach to malaria control. So as most of you, if not all of you in this room remember, the first GMAP, or Global Malaria Action Plan, was launched in 2008 when world leaders and the global malaria community gathered at the Millennium Development Goal, or MDG, Malaria Summit in New York. And this GMAP was designed to provide a global framework for action around which partners could coordinate their efforts. And since 2008, it has been widely used by a broad range of partners working on malaria control. This first version of the GMAP presents first a comprehensive overview of the global malaria landscape, but also an evidence-based approach to deliver malaria prevention and treatment to all at-risk populations. And finally, it gave an estimate of the annual funding needed to achieve the 2015 goals of the RBM partnership, with unfortunately a big funding gap remaining until today. So that first version of the GMAP was designed to cover a specific time period, 2008 to 2015, and since we are almost there, partners in the malaria community decided to go for a second version of the GMAP, GMAP 2, with a slightly different approach. This time it was decided that two companion materials would be drafted. The first one would be the GTS, or Global Technical Strategy for Malaria, covering the period 2016 to 2030. And the design of this strategy would be led by the WHO Global Malaria Program, or GMP, and the steering committee for GTS development, which was chaired by Dr. Pedro Alonso. The GTS will describe what should be done for malaria prevention and control, as well as where and when. The second version of the GMAP, or Global Malaria Action Plan number 2, is being developed by the Rollback Malaria Partnership Task Force for GMAP development, co-chaired by Dr. David Branding Bennett from the Gates Foundation, who will talk to you about GMAP 2 contents in the current format of the draft a bit later, and Dr. Bernard Nolan from the US PMI. The GMAP 2 will guide how different stakeholders, such as government, non-health sectors, development partners, donors, private sector, research and academia, as well as civil society, so a broad range of partners working together on malaria control, can support together resource mobilization to implement effectively the global technical strategy for malaria. So on this schematic representation, you can see how the two companion documents or materials work together. To your left, you can see the Global Technical Strategy for Malaria, working on the what, where, and when, and developed by the WHO Steering Committee. And to your right, the second Global Malaria Action Plan, or GMAP 2, developed by the RBM Partnership Task Force. You can also see that these two documents share the same vision of a malaria-free world, as well as the same goals, targets, and indicators for the period 2016 to 2030. They should be launched together after the Global Technical Strategy is approved by WHO World Health Assembly in May 2015, and will work on making things happen. So there were several objectives that partners kept in mind when developing the GMAP 2. First, that it would serve as an advocacy tool to help position malaria after 2015, so for the SDGs in particular, but also to support the global technical strategy on malaria and its goals, milestone, and vision for a malaria-free world, to mobilize human and financial resources for an effective implementation of this strategy, to focus on the who and how, and to strengthen accountability on the way to malaria control and elimination. And finally, and I will talk to that effect for the remainder of this brief talk, to guide the development of a multi-sectoral response to malaria. So this multi-sectoral action framework for malaria was developed by more than 70 stakeholders, among most notably governments, donors, but also corporate entities. And it was launched last year alongside the 68th session of the UN General Assembly in New York. It was initially disseminated through RBM sub-regional networks, and of note, African health ministers have a key role to play to engage sectors outside the health sector. They started to play that role, and they will have to play an even bigger role in the future to make sure the framework is implemented. Finally, the multi-sectoral action framework is supported by a newsletter launched quarterly, and to date there are over 250 subscribers from many different sectors receiving the newsletter. So what is the multi-sectoral action framework for malaria? What's the content of the document? Well, it was written to emphasize synergies for accelerating both socioeconomic development as well as the reduction of malaria transmission. It analyzes socio-environmental determinants of malaria at 4 levels: society, environment, population groups at risk, and finally the lower level, household and individual level. It proposes priority determinants for each level of the 4 described above, and how different sectors of society can address them. And finally, but not least, it encourages policymakers and health workers to increase multi-sectoral partnerships. And I was, for instance, recently in Uganda, where President Mouzin tasked his finance minister to engage the private sector in Uganda to do more for malaria and to expand the fight against malaria outside the health sector. This is precisely what the framework is aiming for. So of course, the framework builds on history of malaria elimination, and as all of you know in this room, countries that have been successful in eliminating malaria have been successful because they engaged in much broader determinants than the health determinants. They were able to improve agricultural practices, to strengthen health systems, to improve living conditions of population at risk, and to empower women so that malaria could be eliminated. We all know that these improvements will have to be made in addition to delivery of purely medical prevention and control interventions. So what is the added value of a multi-sectoral approach? Well, the stakeholders believed when writing the document that it was threefold. First, that it could reduce the risk for malaria, for instance, through decent housing and good agricultural practices. That it could also amplify the impact of malaria interventions, so for instance, education of children or empowerment of women. And that finally more resources could be provided for malaria outcomes when sectors outside of health were engaged through, for instance, climate change adaptation funds or revenues from industrial investments being routed to fight malaria. So going forward, we see 2 main avenues for pushing the multi-sectoral action framework. First, preparations are ongoing for cross-border multi-sectoral actions, such as the Lake Victoria Basin Malaria Initiative, where 5 countries are currently working together to fight back malaria, Uganda, Tanzania, Kenya, Burundi, and Rwanda. Also the Southern Africa Partnership, involving the International Office of Migration and the RBM Partnership colleagues. Secondly, the second avenue for pushing the framework forward is to profile this framework in key non-health events, such as the WHO Conference on Health and Climate, or the Global Framework on Climate Services, or the Third Interministerial Conference on Health and Environment. So why is this important now? Well, the new UN Development Agenda calls for better integration, including in development financing. That was made specifically clear in the drafting of the SDGs, or Sustainable Development Goals. And also to ensure sustainability of malaria interventions, the socioeconomic causes of malaria transmission need to be addressed. So we believe that the GMAP2 that is currently being drafted will offer the opportunity to push that multi-sectoral action framework forward, and that we'll all be able to do for malaria what UNAIDS, for instance, has been able to do for HIV, which is to push the fight against the disease outside of the health sector and engage all sectors of society in this common goal. So thank you very much for your attention, and I will now hand over the microphone to Dr. Pedro Alonso to go over the content of the global technical strategy with you. Thank you.